Please don't put garlic in your vagina. If your vagina is sick, please take it to the doctor. They were going through some of the cringiest health TikToks that I have seen, because why would we not want to cringe together? Isn't it the law that we have to watch these and feel uncomfortable and then learn something and maybe laugh at it? I think it's the law. I heard somewhere that it was the law, and that's how things work, right? Like, I heard somewhere that that medicine treats things, or I heard somewhere that your hormones are unbalanced, and so now I'm the expert. I learned that on TikTok too. I'm a law expert. This video is sponsored by Native. We'll hear more about them in a minute. That's the intro. Subscribe if you want. Okay, let me be real talk for a minute. I had a serious emotional breakdown yesterday when I was trying to film, like full on ugly cry, sending my husband a string of texts in which I'm thinking he probably thought I was just getting ready to like toss the whole camera through the window. It was embarrassing, and I'm glad the camera wasn't rolling yet because it was embarrassing. I thought I should tell you that sometimes filming really stresses me the heck out. So thanks for watching.
But what are the side effects of birth control pills? Well, they have many nutrient depleting effects, resulting in everything from migraines to weight gain, to sexual disturbances, because it's turning off the natural hormonal production of all your hormones. Because of that, you have nutrient deficiencies as a result of birth control pills.
So I have a few issues with this. When I first watched it, I was like, this person's an MD. Why are they getting this so off center? And then I was like, well, maybe I should look up this person. And then I discovered they are an MD, but they didn't finish residency and they're also not board certified. And then I thought, well, why are they sharing this information? And then I realized it's because gynecology topics get massive amounts of clicks and watches and likes and hearts and stuff like that, which is why I do these videos too. Not really, you guys know I'm passionate about this and I love this field, which is why I'm a board certified OBGYN, but it really grinds my gears when I see people using gynecology and pregnancy as clickbait. Rant over, but let's talk about this. So Amanda Howell, who is a public health expert that I follow on Instagram, recently posted and talked about this. So I will link her Instagram below. Let's tackle this just from a factual standpoint. Does birth control cause nutrient depletion? There are some studies on this that say maybe there is a correlation there. Importantly, they're not great studies, they're kind of small, but let's even just pretend, okay, it's true. There's no evidence that a normal varied diet that's relatively healthy and or a multivitamin can't keep this from happening. There is nothing about being on a birth control pill that should make you assume you definitely have a nutrient deficiency. Eat a healthy diet. And aside from that, if you're having problems or symptoms or side effects, talk to your doctor. I really hate this villainizing of birth control in general. Birth control can cause side effects for people, but it also can be really great for some people. The takeaway is, don't make these crazy videos where you're broadcasting the fear that you think people should have. Just say, birth control can have side effects. If you have a side effect, talk to your healthcare provider. It's really that simple. That is the takeaway. It's that simple. Please don't put garlic in your vagina. If you have an infection, itching, abnormal discharge, dryness, if your vagina is sick, please take it to the doctor. It does not need garlic. Save the garlic for your Italian dish. This has been a PSA. Hi, sorry to interrupt what I'm sure is a very educational and entertaining video for the day, but I wanted to talk about the sponsor of today's video. If you've been around the channel for a while, you know I love Native deodorant. I have been using their products and they have been supporting this channel for a long time. Native is a paraben and sulfate-free, aluminum-free deodorant that actually works. I'm serious, you guys. I have tried so many of these in the past and I'm always left with terrible irritation or funky smells, but Native is different. It goes on smooth, it's not sticky, and it lasts all day. Even on long hikes in the gorgeous Rocky Mountains, usually working up a sweat because one of my two youngest got tired and needed a little bit of a ride on the way down. They have a ton of scents to choose from, including my very favorite, the charcoal. I use it every single day, but I also really like the eucalyptus mint. Native is animal friendly and cruelty free, and they have free shipping inside the United States. If you've been wanting to try out Native and you'd like to support my channel in the process, which by the way, I appreciate so incredibly much, you can get 20% off your first build your own deodorant 3-pack using my link in the description or by putting in code MDJ3 at checkout. Now, let's get back to the video.
We like to just pretend pussies are perfect. Pussies do have issues sometimes. If you are one of those women who gets BV infections all the time or yeast infections all the time or whatever, I can offer you a probable solution. You need to go to the store, Walgreens, wherever. They have these suppository-like type things. Stick one up there, restore your vagina back to its normal acidic pH, because cum is alkalytic, so it can sometimes throw you over the edge.
There's actually some okay information in that TikTok. I don't know what kind of healthcare professional this person is. It looked like they were in scrubs and it looked like they were in a med supply room. There's really no situation in which a medical professional should be giving information on the internet and calling the vagina This is weird. I don't know. It just really bothers me. Aside from that, I've talked about the boric acid thing in one of my other TikTok videos, and I don't know why this gets so much lip service on TikTok. There is some truth in it. Using boric acid suppositories can be a helpful therapy for people who have known recurrent bacterial vaginosis. This is a very specific population of people. This is a highly toxic substance, and you should not be just getting it over the counter and using it at will based on a TikTok. Talk to your doctor and see if they think it is right for you. First off, her eyes are beautiful. I love your hair and your beautiful blue eyes, so keep doing that. What we shouldn't keep doing is sharing misinformation about birth control, because it's gonna make my head explode. Why? Let's just dissect the content of this video. Hormonal birth control can cause leaky gut. Leaky gut is not a medical diagnosis. There is not a correlation of a medical thing called leaky gut. It's talked about in circles of alternative medicine, and in medicine, leaky gut means you have a hole in your bowel, and that would be peritonitis, and birth control definitely doesn't cause that. Long-term infertility, that is false. There is absolutely no scientific data to associate use of hormonal contraception with infertility in the future. Hypothyroidism, adrenal dysfunction, also not true. Low libido. There is some association in people who are taking a hormonal contraception with a decrease in libido or sex drive. Hormonal birth control pills increase sex hormone binding globulin, which binds to free testosterone and keeps it from being as active. This is also why most people see an improvement of their acne on hormonal contraception. So there is the potential for that. If you're experiencing that on birth control, talk to your doctor, see what you should do. You can change, you can go off of it and find another form of pregnancy prevention, or if it's not bothering you that much, then you can just be okay with it. It's not any, reason to make people panic. High blood pressure, there is some truth in that. Estrogen can be associated with elevated blood pressures. When we start someone on a hormonal contraceptive pill, we always want to see them back or have them check their blood pressure at home after being on it for a while and make sure that their blood pressure is not being elevated by this. It is a minority of people who will see a significant increase in their blood pressure from being on birth control, but it is true that that can be associated. Heart disease, no. Blood clots, yes. We know there's an increase in the risk of venous thromboembolism on estrogen-containing birth control pills. If you consider the baseline risk of 1 to be what your risk is not on a birth control pill, and then you consider your birth control risk to be 3 to 4 in 10,000, and your risk if you were to get pregnant would be about 9 to 10 in 10,000. It's an increased risk, but it is not nearly as increased as it would if you were pregnant or recently postpartum. So most of the time we see that as a risk that is acceptable. Headaches. Yeah, I sometimes see people start birth control pills and then have headaches. If you have that, talk to your doctor. Sometimes this hair is bothering me. Sometimes that can be as easy as changing a dose or changing a medication type, or sometimes it's serious enough to say you shouldn't be on estrogen-containing pills at all, especially if you get migraines with neuro changes like an aura that comes prior to having a migraine. That's a contraindication to being on a birth control pill. Liver disease, this is extraordinarily rare. I mean, I can't say that it isn't true because yes, it can cause that, but it's extremely unusual. Inflammation of what? That's not, you can't just say inflammation. Like inflammation has to be of a particular tissue. Increased cervical cancer, that is not true. This has been debunked in study after study. There have been studies in the past which associated being on a birth control pill with an increased risk of HPV-associated cervical cancer. Obvious major confounding factor here is that people are more likely to be sexually active if they are on a birth control pill, and they are more likely to get on a birth control pill if they are sexually active. Being sexually active increases your risk of being exposed to HPV, which is the precursor to cervical cancer in virtually every case. Birth control itself, hormonal contraception, does not increase your risk of cervical cancer. It ends with, no wonder you have a hormone imbalance. I feel like this entire video is me just being angry. Hormonal imbalance is not something that is medically defined. I can't just draw a hormone panel and tell you, oh yeah, your hormones are out of balance. Hormones of all kinds change every day and all throughout the day. Your hormone levels today aren't the same as they will be tomorrow. They aren't even the same right now as they'll be in the middle of the night tonight. So hormone imbalance is not a defined medical entity. I can't just say, oh yep, your hormones are out of whack. Like, that's just not a thing. There are problems which can be associated with abnormal levels of certain hormones, and these are very specific, and you don't just draw a hormone panel. Anybody who is recommending that you just have your hormones tested, or who is saying you have a hormone imbalance and not giving any more clarity to that discussion, doesn't truly understand the way that hormones work.
So I want to tell you guys about the experience I had about asking to get my tubes tied after I had my last baby 4 months ago. So I asked to get my tubes tied at one of my last appointments while I was in the hospital, and this female doctor looked at me straight in the face and said, "Did you ask your husband for permission?" I said, "First of all, I'm not married. Second of all, what does that have to do with anything?" She said, "Well, he might want more kids. Is he gonna carry them? Is he gonna go through all that pain and labor and delivery?" I don't think so. When I had my fiance with me and he told the doctor that he gave me permission, she still told me that I was too young and I might want more kids. We need to do something about this.
I have a whole video on this discussion about tubal ligation and bodily autonomy requiring the consent of a significant other, of having age limits, things like that. So I will link that below. There is some important things to talk about there, but at the end of the day, I very much stand by what this person said. Your body, your choice. If you want your tubes tied and you are thoroughly informed and counseled, then that is your decision. There are obviously some legal limits to that, which I discuss in that video. So feel free to hop over there if you're interested. All right, we're gonna end on a banger because this one's been bothering me a while.
Oh shit! Oh shit!
So I saw this video and commented on it and said to the person who made it, hey, please consider not making patients the butt of your jokes. They were, understandably, because when someone calls you out, it is uncomfortable, extremely defensive, even made like a follow-up, hey, f you video. And I get it, it's not comfortable when somebody calls you out, especially when it's somewhere that other people could see. However, there were a lot of people who seemed to think that I was saying this because I didn't get the joke, or I didn't understand that healthcare professionals sometimes need to let off steam or vent or use dark humor. The simple fact of this is the place where you're sharing this information is a big factor in whether or not it's appropriate to share. If you make a joke about a patient, I still think it's kind of gross, but if you make that in private where nobody can hear it and have a negative effect from it, that's one thing. But if you put it online for millions of people to see and hear, now you have the potential to cause harm. How? There are many, many people in the comments of that video saying, now I am afraid to get care. This is why I haven't been to the doctor in 5 years. This is why I always think they're making fun of me. All kinds of comments like that. If you post something online and you're presenting yourself as a medical professional, and it's not overtly educational or overtly teaching something important, and even one person in the comments says, this is preventing me or why I don't seek care, you're doing harm. You are negatively impacting the people watching that. Even if it's just one person, your net overall is negative. It doesn't matter if 15,000 people thought it was a funny joke. It matters that it could harm one person. We purposefully went into this field. We took on the trust of people we are taking care of. You don't get to play with that. You don't get to do things that shake that trust down, even if it's just for one person. We can make people laugh on the internet, even as medical professionals, without making patients the butt of those jokes. And I know we can do this, make people laugh on the internet as healthcare providers without harming patients, because I'm hilarious. I'm kidding, of course, but there are very large numbers of very, very funny medical professionals who aren't making fun of patients. So just like find a better way. And if you need to vent and let off steam, then do that in private, not in public. Does Does that make sense? Thanks for being here today, guys. Thank you to Native for sponsoring this video. If you're not subscribed, hit that subscribe button, turn on notifications so you never miss a video. That's all I have to say. I'll see you next time. Bye. Don't forget to click that link in the description and check out Native deodorant. It truly helps support this channel.